contains our main unit. Let's first install the 3 brackets. This is the bracket for our thermage device. This is the bracket for our ultrasound knife. This is the bracket for our ultrasound cannon. Let's install the thermage bracket first. There's a clip here. Just clip it in. This is the bracket for our ultrasound knife. The third bracket is for our ultrasound cannon. Get a screwdriver ready. Just screw it in directly. Next, let's go over the installation tutorial for Titan Ultrasound. Here are the accessories for Titan Ultrasound. First, let's install the handpiece for the ultrasound knife. First, clip this head in. Then align it with the corresponding hole. Now let's install our thermage hand saw again. Clip its head in. Now let's install our thermage head again. After installation, align it with the corresponding hole. Now let's install our ultrasound cannon head again. And our foot pedal. And our power cord installation is complete. Next, let's discuss the interface of Titan Ultrasound. Once we install this probe, it can be recognized. If it's not installed properly, there will be an exclamation mark indicating it cannot be recognized. First, we clip it in for automatic recognition. Then a screen will appear. Let's take a look at the parameter adjustments on the whole interface. First, this 0.05 mainly explains our energy level. The over 10,000 here indicates the total number of pulses for this head. This shows the remaining pulses we have already used. And this shows the number of pulses used for the current session. This 2.0 indicates the distance between the points we mark. This is the start and pause button. This shows the total length of a straight line we completed. These specific parameters are adjusted in the back end. Generally, they do not need to be adjusted. Once the thermage probe is installed, it will automatically recognize the interface. Our thermage probe also has pulse bundles. This is our total pulse bundle. Remaining pulses, as well as the energy switch, start, and pause buttons. Next, let's explain the interface of Titan Ultrasound Cannon after clipping it in. It will recognize our cannon head. The cannon head typically has a pulse count of 100,000 and the remaining pulses. This is our energy level. It has a rear speed that can be adjusted. It is generally recommended to set it between 3 and 5. The energy begins to increase gradually. This shows the pulse count used during the session. This is the pause start button. After starting, select to use our foot pedal. Start using our ultrasound cannon head. Okay, first, let's explain the head of the ultrasound knife. It has a total of 7 treatment heads. 4 are for facial use. This is our 4.5. 3.0, and 1 is 2.0, and 1 is 1.5, mainly for the face. The other 3 are for body use. 1 is 6.0. 1 is 9.0, and 1 is 13.0. Next, let's explain the cannon head of Titan Ultrasound. There are a total of 5 cannon heads. 3 are for facial use, 4.5, 3.0 and 1.5. 2 are for body use, 6.0 and 9.0. Next is our Titan Ultrasound thermage handpiece. It has 3 treatment heads. 1 is for body use, 1 is for facial use, 1 is for eye use. We must first perform a deep cleansing for the client. The second part is to conduct a facial analysis and take photos for the client. The third part is to start marking the positioning for the client. First, the purpose of marking is to avoid certain nerve points. First, let's locate the wound. The wound here should avoid the 3-hole area, which is critical for nerves. This position is our infraorbital foramen. This position is our nerve foramen, very important. Then this position is our foramen rotundum. Okay. This 3-hole area must be avoided. It is forbidden to reach. Okay, now, when marking, we mainly target some ligaments. There is a technique known as the 9*6D method on the market. First, we need to work on the ligaments across the entire face. First, for lifting the outer corners of the eyes and the surrounding areas, The main focus is on the ligaments in this area. This is our upper eyelid ligament, the upper eyelid ligament and our wide circumferential ligament. These two areas are particularly suitable. No matter if it's our thermage head, or the ultrasound cannon head, or our ultrasound knife head. The 1.5 and 2.0 are very suitable. The third ligament is our zygomatic arch ligament. The zygomatic arch ligament must be connected. We need to locate this ligament point, and our full skin ligament. Also our maxillary ligament, and our mandibular ligament. Bite down with your masseter muscle. Dear, okay, this is our masseter ligament. And what about this one? The preauricular ligament, of course, there is also the earlobe nerve, must be avoided, about 2 fingers width. And our entire platysma ligament. These locations are all areas we must operate on during the procedure. First, we set the position. Once we locate the ligaments, we start marking. When marking, we first focus on areas like the double chin. We need to avoid the jawbone. We need to target the fat area. The fat area. We can't operate on the Adam's apple area. We need to locate its swallowing point in this area. Target the double chin area above 0.5. The swallowing point is the priority. This position is fixed for the double chin. This position is good. Now, regarding the neck area, this is the area of the double chin. For the neck, we usually feel the Adam's apple. We operate on this side of the Adam's apple. Then on the side, we feel his carotid artery. Because everyone is different. This area is prone to thyroid and carotid arteries, and also the carotid arteries. We must definitely avoid this area. You see, since the area of our operation head is this size, we generally do 2 rows. This is for our neck and chin. Also, for our face, we need to avoid the corner of the mouth nerves. It's about 1 centimeter. Okay, after avoiding, we target the highest point of the cheekbone. We cannot reach the highest point of the cheekbone. Generally, it's around our cheekbone area. Approximately how much should we reach? 3 passes. Everyone, I've previously done ligament localization. It helps you seriously identify the areas to target the ligaments. This will further enhance its effectiveness, so this is the area we can operate on. Okay, then, for this wide ligament and cheekbone ligament, we slightly avoid the eye area. Including the eye area, these are all operable. The brow nerve is the injury point and the distance from the eyebrow is 0.5 to 1. We can operate on all of them as much as possible. We need to avoid this area. Okay, above is our marking. We operate from deep to shallow. Start with 4.5, then do 3.0, then do 2.0, then 1.5. The technique involves fixed points, localization, and direction. First, we start with the blade, then we do the cannon head, and then we do our thermage head. Based on his face. Next, we will operate with the blade at 4.5 plus 3.0. Because the skin still has a bit of looseness. I need to tighten it. The second step is to use the cannon head around the mouth nerves. To reinforce and strengthen it. I might also use a thermage probe. To help with some skin tightening treatment. This might involve a combination of 3 in 1. Okay, next, we apply gel for operation. Now, I will assist him in the operation. After positioning the ultrasound blade, we begin the operation. Our blade has 3 techniques. Of course, you can also incorporate your clinical techniques. To be more professional, there will be 3 techniques. One is horizontal lifting at a 0-degree angle, the second is at a 90-degree angle, creating a grid, and another at a 45-degree angle. At a 45-degree angle, this means a comprehensive facial lift using 3 angles. First, we must apply gel before operation. Apply about the thickness of a coin. Before applying gel, inform the client it may feel a bit cool. To avoid startling them. Okay. After applying the gel, we should not apply it to the temple area first. We aim for a facial lift. Lifting should not use brute force, use a kneading force for the lift. We just explained the interface. This is roughly its top spacing. We estimate that the face is relatively loose. I adjust it to between 1.5 and 1.2. I want to make it denser. I set it to 1.2. As for the energy, I generally start the energy at 0.5. Starting with 0.5. The length is 25. Start the lift after the end of May. Because this is a new probe. If the client operates the probe, it needs to be disinfected with alcohol, then wipe it with saline. The first technique, I use a holistic technique. It involves horizontal operation. First, lift the skin. Draw across his jawline. This line should not exceed 1 to 2 centimeters from his earlobe nerve. Okay, start with the first row. Okay, stop and maintain a gentle pressure. Do not hover. Okay, dear, you're here. Okay, when moving, also lift while moving. Dear, do you feel anything? A little. Currently, the client feels a slight soreness. The moving density is about 0.17 to 0.2. Cannot be too sparse, must be pinpointed. Localization, set direction, set strength, is very important. And the lifting strength must be uniform. You cannot operate like this. Hold it tight. Pull the strength upward. Okay. Next, the second row must be continuous. Okay, inform the client that this position will be targeted. It will hit above your gum line. You may feel a slight soreness. How does it feel? A bit sore, yes, a bit sore. At this point, you can inform the client. The client feels a tightening sensation. A tightening feeling. If the client can handle the energy, we can even increase the energy for the client. To give a slight tingling sensation, the immediate effects will be more pronounced. Okay, this is our second row. Now let's move on to the third row. This should also draw across his jawbone for the mouth area. Its sensitivity will be higher, because the mouth area is mucus. At this point, you should inform him. Dear, your teeth will feel sore. Can you handle it? Very good. We should provide timely encouragement. And let him operate in this mouth area. To hit his entire nasal ligament area, right? Isn't this method particularly sequential? From the first row to the second row, the third row, regardless of strength or density. And the movement is very coherent. It won't be chaotic or haphazard. First, its width is approximately this much. Look at this. And its emission point. The line is in the center. You see, my phone doesn't reach this position. It's just right at this position. So after we finish the operation, the upper jaw ligament is in this position. Can we place this line at its nasolabial fold? To perform what? To tighten and shape the nasolabial fold. This position might feel a bit for you, dear. Then follow his cheekbone towards the zygomatic arch ligament. The strength must be deep, cannot hover above, cannot probe, cannot move forward and backward, cannot tilt upward or downward. Okay, this is our first technique. This is the horizontal technique, 0-degree angle operation completed. The second method is to complete the vertical technique after the horizontal. The entire surface forms a grid pattern. So we need to pull the handle to 90 degrees. At this time, we must reinforce our gel again. Dear, you can increase the energy a bit. Can you handle it? Yes. Okay, this feeling comes after the first warm-up. We can slightly increase the energy for the client. A slight tingling sensation, a slight soreness and a bit of swelling. The effects will be better. Finished, each increment. Then it was horizontal. Now it's vertical at 90 degrees. We need to closely observe this line. Draw the handle across his jawbone. Okay, this line has grown. Naturally, we create a half link. Do you feel anything? Its density is the same. It is now vertical. When operating on the client. For preoperative photography, be sure to use a 90 and 45 degree angle. Angle at 45 degrees for a shot, including its visual aspect and its longitudinal view. We must capture it. For example, some people due to their height, we can slightly raise it, so that line is straighter. Because this stool is a bit high. When I hit the mouth, it might feel a bit sore. Will your teeth feel sore? Yes, very good. I personally believe ultrasound should be more focused on the upper jaw in this area. because the nasolabial folds are quite deep. So after performing each angle technique, I will place this line over the nasolabial fold to collect. This will lift his nasolabial folds and the entire midface upwards. This is the second technique. To enhance and lift the nasolabial fold. Based on his cheekbone ligaments, remember not to hit the highest point of his apple cheeks. Strength is very important. This is what we call pinpoint localization. Setting direction and strength. Okay, we've completed the second technique. After forming a grid shape, is the center empty? At this time, we will use our third technique. This is our diagonal line technique. This is at a 45-degree angle. So our method is sequential. There is a method. It involves techniques, so it won't be that you are continuously operating on one area. That's why the market sees indentations or unevenness in facial symmetry. That's because a professional technique hasn't been applied consistently, continuously overlapping in one spot. So this area should not exceed 10 passes. After 20 passes, they may easily develop subcutaneous nodules, because they have been concentrating energy. So providing this professional technique is not easy. It will absolutely not result in such symptoms. Avoid our facial nerves. So now I will perform the third technique. This is at a 45-degree angle. This is our diagonal technique. Each time we operate, we must apply the gel. Apply it evenly. Okay, this is our 45-degree angle. At this point, ask the client how they feel after the second technique. Do you feel any tingling, a slight warmth, a feeling of slight swelling? Do you? Yes, right? Oh, at this moment, the diagonal line technique will enhance the sensation gradually. See if they can accept it. Do you feel anything now? At 1.44, can you handle it? Yes. Yes, during the operation, we should continuously ask the client for feedback. If we achieve the true clinical response with our operation energy and parameters, its effects will definitely target the intended layers. Then its effects will be more pronounced. Now, the same density of lines can only be incrementally added. It's a secret, so try to keep it even. The strength should be deeper. The mouth area may be quite sensitive now. What if you feel pain at this point? Then I can slightly puff the mouth. This is what I just mentioned during the operation. These are some phrases used during the operation. For instance, which areas you are operating on. You must ask the client, then find the best energy parameters for the client. Okay, this is mainly for the smart layer operation on the face. It gives your face a lifting sensation. After I finish the 45-degree angle, I will also enhance and lighten the nasolabial folds. Everyone can take a look at his face shortly. The entire half of his face shows a significant improvement. Okay, this is our 4.5 probe. After completing the 3 techniques on the entire face, next, we will proceed to operate on the neck and double chin. I've already marked the double chin area. We need to avoid its recommended points. Before operating, we should habitually check for lymph nodes on the jaw. Because some people, for instance, often stay up late, smoke and drink, have an irregular diet, they may have lymph nodes. For patients with lymph nodes, it's best to avoid them. Next, feel for the thyroid area. We should avoid this thyroid area and check the artery. I personally suggest using the blade for the double chin, focusing on one point. But for the neck, we should use mobile techniques. Because this area is beside the artery, there's a side artery sinus. If it's pressed too tightly, if the energy is too strong, it may lead to a reduction in heart rate. This poses a risk. If the doctor suggests pinpoint operations, then keep the energy low. For safety reasons, we should use the moving blade method for operation. Okay, now, I will operate on the chin area. First, let's have the client raise their head. That's right. After applying the gel, start pinpoint operation. Do not press on the bone. Do you feel anything? A little. Can you handle it? The double chin can be pinpointed. You see, my handle reaches near his earlobe area. But this position is currently unreachable. If the double chin is severe, we can help these patients with tightening. You will see that his jawline immediately tightens and sinks in. As for the neck, I personally prefer to hold this position. Operate towards the lymphatic system. This is the direction for lymphatic work, because we should try not to move while pinpointing. If you need to pinpoint, always remember to halve the facial energy. Your tissue is thinner, there are many nerves. I generally prefer using the moving technique. This way, the feeling won't be particularly inflated. It also avoids many risks. Will your heart hurt? No. Yes, you can hold this neck area. Of course, we have already seen many marked lines during operation. Many have already blurred. But we all have a direction in mind. Skilled operators will remember certain important areas. The points to avoid nerves. Keep a rough memory. At this point, I feel that many people tend to aim upwards. If we aim upwards, it concentrates all the looseness in the chin area. You see, we target the face upwards. The neck is aimed downwards. In fact, the most benefited area is the chin and double chin. So this technique has a timing effect, and its post effect will be more noticeable. Next, I will enhance his double chin area. Of course, the 3.0 blade will operate in the same area as the 4.5. Similarly, we will operate in the same area with all three techniques. About 150 passes on half the face with one head. A range of 200 passes. Energy usually focuses on sensitive skin, starting from 0.3. For normal skin, it's recommended to start from 0.5. For aging skin, it's more sensitive. For good condition, start at 0.3. Then for normal skin, start at 0.5. Each head should target between 150 to 280 passes on half the face. Next, we will operate with the 3.0 blade. Using the same method for operation. Now, I am preparing to change the tool. While changing the handle, remember to pause before switching to the 3.0 handle. Of course, I have found the optimal energy value for his ultrasound probe. I am starting at 0.5 with the same spacing of 1.2. Okay, now, we repeat the previous technique. This time, everyone can just observe. The operation method of the last head is the same. Okay. Ah. The same technique. Horizontal lifting. Ah, then we clearly see that this side of the face has lifted. Next, we will apply a value. This angle may be where you want the line to bend. It may require a slight dab. The 3.0 head mainly stimulates collagen production deeply. It can also help burn fat and shape the body. It is generally recommended to reach around 150 to 200 passes. For those with thinner skin, you can start at an energy level of 0.3. Normal skin can also start at 0.5. After that, I still have a diagonal line to do. You can slightly increase it. Find its range around 4.5. When it comes to the mouth area, you should tell them it may feel sensitive. Okay. After each operation, I will target the upper jaw ligament to lighten his nasolabial folds. This is the easiest place to achieve the desired effect. Develop a habit. Similarly, now, the entire 3.0 facial operation is complete. The jawline operation is the same as with the 4.5 and 3.0. If this position is, for example, if there are lymph nodes, how do we operate in this situation? We should use moving techniques. For example, avoid constantly operating on this position. Otherwise, it may become inflamed. No swelling. Actually, you see, I press down. Hey, haven't you already pressed on the Adam's apple? Remember, it only draws a line. It targets a specific line. Okay, now, let's operate on this. Oh, when operating ultrasound devices, either lower the energy for pinpointing, or use a mobile technique for operation. This can avoid many risks. A lot. Do not apply too much strength, especially near this artery. Do not press on his artery sinus. So we should position the face before operation. This will facilitate our operation significantly, so we must conduct a preoperative consultation. Likewise, after operating, I especially like to pull it up and down again. Then to effectively tighten the jawline. This young lady's jawline is also very easy to work with. You can immediately feel the improvement here. After we operate on her jawline, we will start operating with another head now. This is our 2.0 probe for the eye area. This 2.0 can operate on the eye sockets and eyelids. Now, let's start applying gel. Of course, we have a dedicated 2.0 probe for the eye. The 2.0 probe. The 2.0 is primarily used on the eyes. Of course, adjust the spacing to 1.2 for energy. I start at around 0.2. Starting from 0.2. Then we locate the entire external ligaments from the full skin ligament and to his upper frame ligament. Proceed with the operation around the eyes. For instance, areas like the sunken temples. For sunken cheeks, try not to focus too much on targeting. It would be more appropriate to slightly skip or gradually increase over it. Okay, first, we take my sister's method. I feel like I said something. This cool side, look. But I don't want to hit that area, just slightly move the technique. Now, he feels a little. We can slightly increase it. Decrease a bit. For those with sunken temples, we can use a moving technique to glide over. If not, we can target the external ligament area. Mountain, at this position. Okay, for the upper eyelid, how should we target it? It's about addressing the area near the brow ridge. Move upwards towards the brow ridge. But I personally suggest for the eye area, the upper eyelid can also be enhanced. Tighten it. Do you feel anything? It's generally recommended to perform the operation. For the eye area, it is recommended to operate at least 3 times. Because we also need to target at 1.5. The operations at 1.5 and 2.0 are the same. The techniques for the whole face and the eye area are identical. Now, you can consider this head as using 1.5 and 2.0. For example, for those with enlarged pores, or many fine lines on the face, you can use the 2.0 and 1.0. Of course, we can. That is also fine. Now, I have finished operating on him. Wrap head. Because of his skin condition. For the wrap head, I will mainly focus on tightening. I may choose a wrap head for him. His skin condition is still acceptable. I may choose a 4.5 fascia cannon head for reinforcement. For clients with thinner skin, with more fat, you can use a 3.0 cannon head for reinforcement. Not all probes should be used. All probes should be used. The 1.5 is identical. Now, I need to operate the second mode. This is the second probe, our cannon head. I need to reinforce and strengthen it. So at this time, I will use a 4.5 cannon head for operation. I just mentioned many ligaments for the cannon head, including our full skin ligaments, upper jaw ligament, the lower jaw ligament and the masseter ligament, and ligaments, cheekbone ligaments, zygomatic arch ligaments, the tight and broad muscle ligaments, upper frame ligaments, external frame ligaments can be operated with the cannon head. Use a circular motion for operation. Of course, I'm currently using the 4.5 head. At this time, we need to use our foot pedal. Because this interface is sensitive. So we may have already recognized it. Now, the energy starts at 0.2 and clicks at 3 Hz. Once you are skilled, click to start at 3 to 5 Hz. Similarly, we need to mention this price. It needs to have its own. Coherence R. This is something I can mention. Then does stepping on it feel good? Heavy on top. I think he hurts. I can be a little slower. Then walk to the place that is like a ligament to him. You can do something and make circles. The position of the children's ligament. All ligaments. Female lead master. When walking through the cannon tube at this time, just need to step on it once. It can start happening. If you want to pause, you just need to step on it again. I am heavy when I go up, and light when I come down. When going up, it is heavy, down is light. Then you can let him look up. Walk his lower jaw neck wide ligament area. Do you have a sour and swollen feeling? Can accept. This energy is very suitable for him. So the energy of our cannon head is relatively sensitive. The skin should still start from 0.1. Does everyone still remember that the blade head is from 0.3? Then the cannon head can start from 0.1. You can walk more around his oral and mandibular ligaments as well as the position of this maxillary ligament. Because of my eyes. Wait a moment, I want to give him a walk. There aren't many of the hot magic ones either. So I didn't let him walk too much. When we operate at a certain time, another hand also needs to have a hand to provide comfort. This way the customer looks outward and makes circles. It seems that the operation of this knife head cannot reach the place of the ear nerves. If it's this position, you can walk this small U-shaped path. Just at the position of his one ear ligament and neck wide muscle ligament. It will have a more three-dimensional tightening along the entire lower jawline. So how much do we generally recommend for half of the face when it comes to the cannon head? A cannonball's worth of words is probably enough to make about 500 to 1000 shots. The operation method of the 3.0 cannon head is exactly the same, Good. Then if I just want to operate on the eye area cannon again. How is it operated? The bubble head around the eyes is to be used with our 1.5mm. The operation method of 3.0 is the same as that of 4.5, Then we should first go to pause. After pausing, press this slot to switch. Good. It also recognizes. Probably we know its energy now. We will start from 1.0 with the cannon head, then the box of 2 is ready to start. Then what should we do with it? The eye area gel must be applied evenly. Put our foot pedal into 1. Pull over, because this mobile strengthening consolidation is. Places like this can perform procedures on the forehead and around the eyes. Can draw circles. It seems to have no force. Actually, it still used strength. Then this is a general way of operating 1.5. Then next, because of his face, we still need to help him do a skin fit. Then I will let him use our third handsaw. It's just a handsaw for our hot magic. So this mainly works on, our eye area. Then I want to help him do the upper eyelid a little. Then I am probably an energy eyeball now, so the energy shouldn't be too high. Probably starting to operate around the eyes from 5. Then he also has one that is facial. There is a body, so I will first operate on the eyelids around his eyes. If the customer brings colored contact lenses, make sure to let him take it off in time. Then, if you want to operate, you must do this so that you can operate at a fixed point. Our eye area fixed interface also starts from 5. Do you have a feeling of heat? It is slightly warm. We need to stimulate its collagen proliferation with deep coherence. Good. Just increase it slightly. For example, because the width of his eyelids is relatively narrow, at this time I might have to adopt some measures. That is to say, for example, history is used for gauze. You might use gauze to pull around his eye like this. Then one of its sides outputs better. Will it hurt? Will not. We use dual-level radio frequency in our hot moji. Very safe and secure. We follow its hip ligament to carve the bone degree upwards. Don't oppress his eyeball. Dear, do you feel pressure on your eyeballs? How many shots does it roughly reach? How much energy has gone? Probably is the energy words. We will start adjusting from 10 around the eyes. Then jump from 5. How many squares will it roughly reach? It is just me 50 to 100. If he specifically wants to address the eye area, then we can give him a relatively larger number of spells to choose from. You can also go to do a treatment head separately. This is based on the doctor and operation of this consultation room. It is to analyze the combination of probe treatment for him. Well, we can slightly increase it a bit more. Does this have a feeling? Is it equivalent to being able to bear it? Ah, very good. It just needs to have a slightly warm feeling. Its timing effect will be better. Operation around the eyes. Then he has just mentioned what I also talked about. It is at this time of theoretical professional knowledge. There are two ways to use our thermage. It's just a fixed point and a way to elevate it. Then I give it as an eye part. Basically, I am using our fixed point. It is an I want him to concentrate the heat. Because his facial features are relatively small. The area is relatively small. Choosing a fixed point will be more effective in concentrating energy. Sometimes feel like I can bear it. Ah, it includes the intensity of oppression. This is our eye thermage operation. Next, I will perform a facial thermage procedure on him. I want to help him with a skin compression and reduction. Switch this face again. Probe for applying to the face. Ah, it is 680. The 600 shots mean that our energy is roughly from 20 kilograms. The words about the eyes just now started from 5, right? Then our facial talk starts from 20. There are two techniques for facial treatment. One is our fixed point. And our one proposal for the ligament style lift. It is the same. At the same time, we need to find a binding point for the face. First, you can use a grid method. First, let's do this preheating. Is there a feeling of heat in the way of making squares? Have. Slowly increasing is good. This is the operation of making a grid once. We basically feel that thermage is experienced by everyone. The basic amplitude parameter value is between 40 and 60. Everyone's skin can withstand energy differently. The sense of heat has increased. Can it be endured? This is our targeted operation. That is our grid method. When we operate, we must definitely apply force downwards before proceeding with the operation. How many shots should I hit? In fact, basically if you hit all of your heads together. At least one side you need to ensure is at 180. If it's twisted dough feeling is relatively strong, whether it is aging type twists or filling type twists. You can specifically just hit one head, or you can say at least all the heads have been hit. You must ensure that one side has a quality of 180 to 200 shots at least. Is there a feeling of heat? Then our fixed point thermal sensation is basically around 20 to 30. It is starting to feel something now. Then next, this is my fixed point operation method. Fixed points are basically like the face. Neck are still the same risk area for neck lymph nodes. I suggest using a mobile approach. Then we can slightly adjust the energy to 40 for the mode of movement. The mobile method also uses a 45-degree angle area for mobile movement. Then it found the place of our ligaments. Can you withstand the heat of the pull? Can. Our energy is very precise and stable. Everyone can see that his skin has already brightened up. Still a bit of heat, right? Good, then let's take a look at our neck. Try to lower it to 30. Good, then go in next week. Similarly according to its line outline R. This is one of our mandibular ligaments. And our tight ligaments. In this area. Can we have a very hot meeting? The way we hold our necks is actually the same as the way we hold our knife heads. You see, just go towards the 08 direction to hit. You can operate at a fixed point. Fixed point operation means we need to adjust the energy accordingly. Hair, for 03040 still cannot hit the fixed point at the neck. This is the thermage for the neck and eye area. 3 hands are used to operate. The entire half of the face afterwards are. Of course, the way to operate this side of the face is the same as that of the face above. The most important thing is that our consultation room and our procedures are equipped with this plan. Not all treatment heads are together. It must be based on the customer's skin condition. An examination of aging conditions produces a combination. Then present the most perfect anti-aging effect. The above is the practical operation and technique of our 3 ultrasound probe facial treatment heads. After we finish the whole face, we start to give the client a regular temperature mask. If in the winter situation, we can soak our face masks in warm water for a while. Except for that sensitive skin disease. For example, patients with urticaria or lupus erythematosus. He may need to lower this temperature in time to be able to take the ice. Other normal words, we try to use masks at room temperature. Let its temperature persist. Let its heat energy continue to stimulate collagen. Apply morning and evening. Probably apply for about a week. Don't go to the sauna or laugh out loud. Just pay attention to facial expressions. Eat more collagen. Then when sleeping, try to elevate the neck a little. Don't sleep on too high a pillow. Raise the neck and neck cushion a little higher. Sleep a little lower. Then don't play with your hands often while walking. Just playing with the phone and looking down. Raise your head more appropriately. Then during this period, he might have some issues with his face being uneven. There will be a bit of swelling sensation. Probably in about 3 to 7 days there will be a small swelling phase. However, there's no need to worry. About a month later, he will. It will disappear after a week. Especially when washing my face the next day. Go press down. It will have a bit of a sour and swollen feeling. It is a very normal phenomenon. Because it has already tightened inside. On the surface, there are no ripples. In fact, the deep layer has already appeared in this tightening phase. A stage of collagen synthesis, so it will still have feelings. It's very normal. Our masks are usually applied for 15 minutes. Medical masks should be applied for 20 minutes. At this time, if the skin is a bit red, you can shine this red and blue light to carry out an enhanced repair. After finishing, you can also apply some moisturizing cream. Can also apply makeup immediately. Makeup for Jike must pay attention to sun protection. Next, I will explain the body's arm and the outlining and operation of the abdomen. So this is the arm flab talk for weight loss and fat reduction. Generally, we use this 6.0. 0.0 knife edge. First and foremost, it is to find its fat area to hit the flexor muscles. Then generally avoid the area 2 fingers away from the armpit. Then find a fat area of it. So this little brother basically has a lot of muscles. There is nothing. This butterfly sleeve is generally found in this area. Go send it. Then we operate according to the direction of the lymph in the palm of our hand. Then it can be fixed at a point. It can also be, sliding. Apply the gel. Our beauty bed allows customers to operate in a slightly raised hand position. Then the operation is a one-time operation. My energy probably starts from 0.35, because it doesn't have much fat. There is relatively more muscle. Start from this. Just walk in the direction of the palm with the same technique. Don't hit under his armpit, there are more lymph nodes. This fat operation is still relatively simple. Do you have feelings? Isn't it slightly this year? Well, at this time, it is already destroying one of its fat cells. Basically, for the whole arm, it can start from 0.3. Then slowly increase one arm half side. If operating the knife head, it is probably about 300 cubic. It's based on fat, right? Some fat is relatively more. Then, like our little brother today, he doesn't have much fat. Basically, it's mainly about the muscles, just giving everyone a brief demonstration. It's just how we operate the blade in what way. Then the main thing is not to hit the muscle. It's just a bone of the arm. Also this armpit lymph node area. So one of ours is a technique from Baotu. Then we have one more, which is our cannon head. Of course, the cannon head has a body of a cannon head. It is to use this M drawing technique to operate. It is also using one of our 6.0. Then it has to use this foot pedal cannon head. Can you sprinkle it a little higher? Go strengthen and consolidate. It's also in a circular way. The strength can be a little heavier. Probably around 500 to 1000. If there is a lot of fat, it may go up to 1000 to 2000. Even 5000 is possible. Mainly looking at its light, medium, and heavy. It also needs to go in circles. The strength must be strong. Do you feel it? It feels sour. This is a way of operation for our pullover. Just operate in a circular way towards the 08 direction. Then next is our, operation of thermage. The operation of hot moji is to draw the body head. Is it the same as burning fat? If it feels hot at a fixed point, can adopt mobile. But if you burn fat at a specific point, I generally suggest starting from 30. All ways of the body are the same, It's just about your matching. The treatment plan you provided. That generally uses more commonly used blades. For example, it belongs to that kind of, very high in fat. This might be used. The 6.0 blade will have relatively more cuts. Do you feel hot? Is there no soup? Because our fat is going to undergo a, fat cell burning. It may just be that the force is applied more deeply at specific points. For example, if you operate a lot, your face may become quite red. It can be slightly adopted in a mobile way. Can negative energy be endured? Can. If its energy is not strong. We can start to increase at this time. Generally, the body's energy starts to jump from 20 to 30-20. Operate in a fixed point manner. Then generally like the legs. This is the leg part, this is the auxiliary breast groove. When the accessory breast groove opens, it's 2 fingers wide. It's the same as the arm. The calf is basically that muscle, right? The thigh is just the inner thigh fat, and you can operate in this direction. It also follows the direction of the lymph flow from the soles of the feet, which is basically the same way as our arms and legs. The main thing is to look at the spell you matched for the guest. Next, we will explain an operation on the abdomen and draw lines. Then the abdomen is our waist. It is operated according to this health-preserving method. What is mainly to avoid? Avoid this bone around. Rib like this bone here, it must be avoided. Go touch the edge of its bone. And that one here too. Like what a typical girl would say, we'll just avoid this. It's one at this position. One at this position. This is the ovary, right? Cannot be without fat. Then don't go hit it. We are at a position that still avoids our belly button. Probably around 1 finger. About 1 finger's width around the belly button. So when we operate, we will do it according to our methods of health preservation and maintenance. According to this promotion field, the promotion stage is to operate in this direction. Go to this degradation site, this location, and operate in this direction. It is also our clockwise operation. Then the operation is to first use the knife, then the cannon, and finally the hot magic. We also need to apply the gel before we operate. We tell the patient. The most important thing is not to hit one of his bones. Probably in terms of the body, its fat thickness is here. We can slightly increase the energy a bit higher. If you do the abdomen, it's probably 9.0. 9.0 basically if the energy blade, we can start adjusting from this 0.5. I generally suggest adjusting the spacing to 1.2. Good. Click to start the operation. Good. We can first operate from this horizontal direction or this direction. First, I am performing pinpoint operations in this direction. You don't need to press too hard. Then we mainly just need to use kneading force to press down. Go in his direction. Do you have feelings? Millimeter. At this time, we can slightly increase. You see, just now when we did the arm, it was about 0.45. It has a feeling now. Now we will start to strengthen a bit. Then the second one. Do you have feelings? Is it a little bit? Good. I will operate in this direction first, then walk in the direction of the clockwise direction. Then at this time we can still increase a little bit. You see this direction, what does it feel like now? Isn't that bearable over there? It hurts. You have something to say. We can operate regionally, but it must be operated in a clockwise direction. Be sure to avoid the ribs around him.
你看，现在我们到它的一个降解肠了哈，它可以让它的肠胃。
You are following this clockwise direction. His gastrointestinal tract will also get some peristalsis. It's just about walking to, if it's like his belly. Probably the knife head we might operate on will be 500 to 1,000 shots. If it were a little bigger, it may require a knife head that sends out 1,000 to 2,000 shots for treatment. Just keep destroying one of its fat cells. Then at this moment, we operate out our blade of our body. What happens after the operation? Just let him wear some shapewear. Include doing some newspaper rituals. It is just burning fat. Just, match some essential oils. The one that generates heat energy, the kind that produces that feeling of heat. Good, this is our blade. Then our cannon head's words are actually, throwing words. That means using a 9.0 cannonball. Of course, at this time, we can also start the energy from around 0.0 to 1.0. Because we just used the blade to about 0.8 or so. This needs to use a foot pedal. Then he also just doesn't want to hit the bony area and the navel area. It is also in a clockwise direction. Do you feel it? So how many shots does the cannonball roughly reach? Because the cannon head also needs at least a whole belly button. With an area like this. Also went to around 3000 to 5000. The bean skin that is possibly a bit larger needs to reach 50 to 110 million. Then it can't be here at that time, it must not, otherwise it will cause bloating. You will downgrade this long order and put it in a position on his body. Then he will have bloating, abdominal pain, feeling of heaviness in the abdomen. I must go clockwise. You see, it looks like we're hitting our waist and abdomen, just hit in the direction of pushing the body according to this. This is the operating technique of our cannon head. You see, like the blade at our waist and abdomen.
这个刀头的话，就是可以让它侧过去。
Just the words of the cannon head are enough. First, let me demonstrate our body's thermal magic to you. Then the hot moji is basically like this belly. We suggest just to do a body probe. It is the way to fix the grid. The entire face was operated on him because it just reached 30 when doing his arm. At this time, we can completely start from a 40. The body has a certain amount of fat on top of his belly. Similarly, there should be an order. Well, it also needs to have strength. Do you have a feeling of heat? Take your time. We can have this small circle just like this small circle. Then the second big circle, then operate like this in the third large circle. It's just increasing income. Good. Do you have hot dry noodles now? Then basically it's all about doing the body. I am now on the second lap. Then basically, if we talk about the body, like his abdomen, it can definitely be a headbutt. It is the abdomen, Then like, belly orange peel. Doing this hot magic can smooth a lot for him. This is hitting the second big circle. Just follow this order to hit. Millimeter, go to locate and hit. I think the areas with fat are still targeted at some places other than the face. Just that the hot magic still needs to go to the designated point. Because it needs to allow its fat cells to be heated more precisely. Because the face mainly involves some ligaments. So we are good. This is the second lap, then proceed to the third lap. Just operate on the entire fourth lap. The above is an operation of 3 fingers on our entire abdomen. Then since we are talking about this, some customers want to do some waistlines. When making a waistline, it's basically about avoiding this bone and that bone. Then just keep on and on. How about that? Just go and hit this, waistline and it'll be fine. This position is very easy to create a waistline. It's right at this position. This is probably where we know his energy is. Then this is not like, this needs to avoid the belly button. This mainly just avoids the bones on both sides. The main thing is that we want to give him a feeling of a waistline. Correct. Is it just a feeling? Therefore, add a little bit here to number 2. 141 payment is payment R. In fact, we make the head of the body by doing more, which serves multiple functions like a butterfly sleeve on one arm. Bye-bye meat. Then the abdomen goes to our waist. Then to the inside of our thighs. In fact, the calves usually have more muscle. The inner thigh is actually the same as operating the arm. This side is basically muscle. Mainly over there on the inside. This is mainly to stack this blade. Probably around 500 to 1800 like this. Then the cannon head is also movable, also all mobile. If I talk about it, I basically want to create a waistline. It is to use this kind of this mobile method to do this line. Just the waistline of this area. Let it be heated in multiple layers. Of course you bring density R, for example, if you follow this health-preserving method and walk while making an improvement. Then its effect will be better. This will make the stomach circle more. This waistline is basically just going back and forth. Back and forth, the treasure belt hot magic can also go back and forth. Because it is heated. We mainly let it form this waistline. You can set a specific point. This also starts at least from 2800. The starting price of 2800 for hot moji is also very simple. It's the same. Probably we know he probably operated to 45. Then during the operation, it's just moving and moving. You need to use some strength. The waistline can use a bit of strength. The intestines are because they have many intestines, so it can't be too much or too forceful. Want that intensity. This can also be fixed at a point. It's very easy to create something that not only adds beauty but also tightens. It is very easy to create its waistline. Then basically in terms of operation, I suggest that when it comes to the body, we use the probe of our thermage. The above is the overall operation of our entire arm, abdomen, and waistline. The explanation above is a practical demonstration of our body. Then some competitive areas and techniques. So actually, our body can also operate something similar to this kind of fatty lump. Trapezius muscle and our accessory breast, and also our breasts. But my personal suggestion is to include this luxury bag. Be sure to find out whether it is fat type or muscle type. So if it is of the fat type, it can be operated on. If it is simply a rich bump of muscle strain, it is because it is for the brain blood in this area. Basically not recommended to operate, because the trapezius muscle also needs to be determined whether it is muscle or fat. So this must be practiced clearly. It is also not recommended to operate on areas with breasts, because the breast system is relatively fragile. The fat of the accessory breast must also be confirmed. So generally the probe for weight loss includes whether it is the blade head. The cannon head is still our hot magic head. My personal suggestion is to try to work on this arm flab. Also this abdomen and waist. Also the fat on the inner thigh. And, a lift for the buttocks. This fat burning and shaping is enough. Try to avoid these areas, unless you have this parameter very precisely. Each includes this clinical experience. You can go in and operate. Those who do not understand can ask our offline teachers for questions and answers. The above content is all of our operations.